One. Good day from Miami. This is Dr. John Bennett with Neurosurgical TV. Today we have the pleasure of having Iype Cherian. He's going to talk about priorities for the young neurosurgeon. And first, let's go around the panel and introduce everybody. We'll start. Is Warlix here? Is it? Okay, Warlix, could you please introduce yourself?
Hi, I'm the neurosurgery resident last year.
Last year, senior resident. Okay, Jitin, could you please introduce yourself?
Hello, sir. My name is Jitin Bajaj. I'm a fellow in functional neurosurgery at All India Institute, Delhi. Good evening.
Welcome, Jitin. Tan May, could you please unmute and introduce yourself?
Hi.
Go ahead, Tan May. Go ahead. Okay, well, I'm sorry, once again?
I'm a final year MCH neurosurgery resident in India.
Okay, welcome. Ibrahim, could you please introduce yourself?
Hello, I'm Ibrahim, and I'm a resident first year in Thailand Federal Center of Neurosurgery.
Yeah, and Ibrahim won a neurosurgical skills contest. I guess you must be tired of me saying that. And Vladimir, you on camera yet? No, he's not. Okay, let me see who else we have here. Ramesh, can you hear me okay? Could you please unmute yourself? Let me unmute you and you could introduce yourself. Hold on. Okay. Ramesh, could you please introduce yourself?
Hi, thanks, John. Hi, Iype. I just thought I'll say hello to you before I head off home. I've just landed in the airport here and waiting for the cab, so I thought I'll say hello to you. I missed you in the meeting, but hopefully we'll catch up soon.
Oh, that's great, Ramesh. Thanks for coming. Thanks for coming. Marco, could you please introduce yourself?
Hello, everybody. My name is Marco Meloni. I'm from Italy. I'm a consultant neurosurgeon.
Yeah, welcome, welcome. Okay, Ramazan, I don't think he can hear. Dr. Cabulo. Just unmute yourself, Dr. Cabulo. Okay. I need to unmute your doc. Okay, go ahead. Go ahead, Dr. Cabulo.
Okay. My name is Dr. Cabulo from Democratic Republic of Congo, currently 40-year neurosurgery resident at the University of Zimbabwe.
You're in Zimbabwe. Okay, very good. Okay, Iype, it's all yours.
Yeah, John, you know, after I rebooted, the computer is not working. So my presentation is completely, you know, I mean, it's, I can't get it out. But then, so forget the screw the presentation. I'm going to talk to you, I mean, whatever I prepared. Hello? Can you?
Yes, we can hear you.
Okay. We can go to the main screen. Yeah, so today the talk is on the challenges, paths, and nuances for young neurosurgeons. So we started off You can see me and hear me, John? Yes?
Yes, that's better. That's better.
Okay. Yeah. So I'm going to talk about the struggle that every young neurosurgeons face. First thing first, as soon as you finish, you know, you suddenly became a neurosurgeon. So from a resident to a neurosurgeon, the transition is not easy. Suddenly you have this bit of greatness thrust. One day you were a resident, and the next day suddenly you are a neurosurgeon. So people start addressing you differently. When you are a resident, you would be treated slightly worse off than a dog. That suddenly changes, and you know, a lot of things changes. So suddenly a lot of greatness is thrust on you. And so your responsibilities also increase. Well, not if you are joining the same department. A lot of people choose to do that. But let's say you moved out from your department and you moved up to the corporate hospital, or you moved out to a place where you are manning the show single-handedly, or let's say you moved out to a place where there is a boss and part of the team, whatever. Things suddenly change in one day. That's the number one thing that a young neurosurgeon will face. You could be in a resource-limited center. You could be in a center with a lot of resources. Whatever, the first thing that happens is this change. So the young neurosurgeon needs to he has to adjust to this change, take up the responsibility, and take this big step forward into a world which is unkind at best, a lot of politics, a lot of complications, a lot of problems, and the learning just starts. So this is what the young neurosurgeon has to get into. We all got into that. I mean, I got into that about 10 years back. Now, the second thing is a big, do you take up safe cases like chronic subdural, surface meningiomas, lumbar discs, safe cases, or do you take up big cases? So the advice that you all get is make a name for yourself first. And once you make a name for yourself, then you can go ahead and take up big cases. That's never going to happen, believe me. Okay? Big cases need to be taken from day one because you're a qualified neurosurgeon. I know people may differ from me. I mean, people may differ from what I have to tell you. But believe me, if you're not going to take up big cases, if you think, let me do it after I attain skills, you're never going to attain skills. You would always be the lumbar disc, surface meningioma, and chronic subdural neurosurgeon. You make a lot of money, that's different. You make a lot of name, maybe, that's different. But you're never going to be the real cowboys. You're never going to be amongst the real cowboys out there. So anybody who tells you this is not a case for you, you should not take up this case. Well, I mean, don't smile to them, take up the case. Okay? Lesson number one. The next thing is, you worried about complications, you worried about whether, people say this guy is a killer. Of course, if your skills are not there, if you don't know where to draw the line, you're never going to be a success anyway. So, from the first day, when you step out of your residency, you are ready for big cases. If you think you're not, go do a fellowship with somebody who's good. And fellowship should be 6 months to a year. You don't need more time than that. Can you hear me?
Yes.
Right. After the fellowship, start off with big cases again. Never believe those people who tell you this case is not for you. You cannot do this case. Okay? I hope that point is proven for all the young neurosurgeons. Number two, whenever you pass out, as soon as you pass out, there's a choice. You could join a place where you can make a lot of money and your learning is limited, or you could join up a place where you have a lot of learning, but money is limited. Okay? I tell you, you could either be a legend or be rich. Very difficult to do both. Okay? Remember this. You could either be somebody who is really narrow, deep, the best in his field, or you could be a jack of all neurosurgeon who does everything from spine to skull base to vascular to everything, but is never best at what he does. Good at what he does, but never best at what he does. Because he's wide, shallow, not necessarily shallow, but wide, shallow, not narrow and deep, and also makes a lot of money. I mean, again, this is completely a matter of choice. I'm not saying one is better than the other. You want to make some money, you want to have an rather easy life, you want to have good family time, you want to be busy, choose the latter. If you want to be a legend in skull base or spine or pediatric or endoscopy or anything, choose the first choice. Have the first choice. Narrow, deep, less money, academic institution, hard work. Point number 2. Point number 3, in the first years of your career as a young neurosurgeon, you guys always have a problem choosing whether to go for courses or not. Whether I should go for this course. Should I do this course a little bit later? There's a cadaver course, but the course fee is $1,000. Should I go? Of course, yes. The answer is always yes. The only way you're going to learn skull base or learn spine or learn endoscopy is cadaver courses. Cadaver courses, surgeries, failures, cadaver courses, surgeries, failures. This cycle keeps repeating. So, cadaver courses is important, surgery is important, failures are important. Okay? If any surgeon says, oh no, from the beginning I've been doing skull base and I've never had any complication, avoid him. Okay? Don't go listen to his classes, believe me. So, your learning is cadaver courses, surgery, failure. Back to cadaver courses, surgery, failure. In between, there would be a lot of cases which do well. You don't learn much from them. The more you have failures, the more you learn. The more you read your surgeries, being unable to sleep at night because of your failures, your complications, the more you will learn. Of course, you need to go to cadaver courses and you need to discuss with masters. You need to be open about your results. There is an ability that we have, and that ability is to lie to ourselves. It's very easy for every surgeon. You do a case and then you say, oh, there's nothing left. Tumor's out. Well, you can say that to everybody else, but to yourself, you must say, no, this tumor is not out. This tumor is still in. And I need to improve myself more to take this tumor out. So don't accept things which your mind tells to you to console you. Of course, when you are broken, you need some consolation. You need a tap on your shoulder. You need to say you did a good job. But be critical of yourself. Never stop criticizing yourself. Never stop learning. Keep the cycle. Surgery, failure, cadaver course. Again, surgery, next failure, cadaver course. Don't think I'm asking you to fail all the time. No. When you do this cycle, you will see that your failures will come down. And then it will be for the next surgery. Once you mastered something and your failure rate is much less, for example, let's say you're doing aneurysms. This cycle will take you to a place where you're very comfortable with aneurysms. And then you go to the next phase, which would be skull base. Then next, maybe endoscopic skull base. And then once you get comfortable with 3 or 4 of this, you stop. You say, no, I'm not doing spine. I'm doing this. And then you keep improving. And then your definition of failure becomes stricter, which means your attention to details increases. So today, if death was a failure, tomorrow morbidity is a failure. Day after tomorrow, unclean surgery is a failure. The day after that, long surgical hours is a failure. So this is what you define. You constantly improve, evolve, make mental notes of things that you need to do. Understanding more and more understanding of 3D anatomy. And this is what you need to do. So I made 3 points clear. The next is something that I've seen a lot of neurosurgeons complaining about. You know, they say, sir, my boss is hogging everything. You know, as soon as I go to the theater, he doesn't allow me to do anything. He starts from dural opening to dural closure. So I tell them, open and close with a microscope. Open and close with the microscope. The boss goes off after dural closure. No worries. You close the suture, you close with the microscope. Microscopical skills are not about taking meningiomas out, not about taking gliomas out. It's about skills. If you can drive anywhere. If you cannot drive, whether I put you in Pune or in South India or anywhere, you cannot drive. It's very simple. Skills are something you can cultivate in an animal lab, in chicken wings, in closure, using the microscope anywhere. I remember the times when I used to sit and draw things under the microscope, put small dots under the microscope. So that is how you develop skills. It's if you complain, the boss doesn't allow me to do anything. Yasagil was in an animal lab till he was 42. He never did any surgeries till he was 42. Only after that he started doing his surgeries. So anybody who complains, there is very little you need to cultivate skills. Do that. Find out a way to do that. Another thing people tell me is that, no, I don't have any infrastructure. We are in this country. We are in this place. We don't have infrastructure. I remember when I came to Nepal for the first time, I didn't see a microscope. It was very depressing for me. I had a bipolar which was barely working and a suction. So I called my uncle, who was a neurosurgeon himself, and I told him that I have an ENT microscope, a bipolar, and I have. He said, for the last 100 years, most surgeries, the best surgeries have been done with just these 3 and a good surgeon. So you must remember that while you may not have the most fancy tools, you can do excellent surgery with just common sense, good understanding of the scans, and unhurried, good, calm, brave surgery. You must always remember this. In whichever place you have, a cheap microscope is easy to get. A bipolar costs nothing. And a suction, well, every theater would have it. And you can take out every single tumor. You can clip every aneurysm. With these three things, you can do everything. Well, of course, the comfort level is different. But when you're young, your advantage is that you have unbridled enthusiasm. You don't have too many failures, so fear of failure is not there. You are ready to go. So this is what you got to take advantage of. Go for it. Okay? Don't wait for your infrastructure to arrive. By that time, you would not be a great surgeon. Another thing, the last thing I must say is be lucky. You know how to be lucky? Be kind, be nice, be forgiving. I have never seen a technically brilliant neurosurgeon who's street smart, cunning, and political. These are the three words to avoid for a young neurosurgeon. If you are street smart, cunning, and if you have a lot of influence politically, you are a politician rather than a neurosurgeon. A lot of people become that, and that's their choice again. But if you've done neurosurgery, there's no point being a politician. You should have gone to politics before that. So avoid street smartness. Avoid being cunning. Avoid politicians or politics. Be nice, be kind, be forgiving. You do that, you'll be lucky. And believe me, luck is a much bigger factor than you ever realize. I always tell my residents and tell all my friends that when Napoleon was asked, what kind of generals do you want? He said, bring me the lucky ones. Very important. You can do a beautiful surgery and the patient may never wake up. Or you may screw up completely and the patient would be, next day talking and walking. This happens too much for a coincidence. And you must understand that being lucky is important. And these points, if you follow, this is going to take you to, different paths. As I said, nothing is wrong. You want to make money, you want to be with a corporate, you don't want to be a legend as such. You want to make some money and be a corporate and be happy and do good surgery. It's possible. Nobody is blaming you for that. You want to do all surgeries. Nobody's blaming you. But you can't be the best when you're doing all surgeries. Another point I would like to stress with the young neurosurgeons. You guys are neurosurgeons, not writers. I always tell people, a lot of people have this against me. But believe me, you are professionally skilled people. Your primary aim is not to write some nonsense paper, reviewing all the data and looking at statistics and spending your time looking at statistics and be puzzled by it. No, this is not your job. Your job as a young neurosurgeon is to attain skills. You spend that time in a lab, in a cadaver lab. You spend that time anastomosing chicken wings. You spend that time doing surgery. Some people say, oh, we write papers as well as do surgery. It never works that way. Okay, believe me. It's not because I'm completely against it. It's because it doesn't work that way. You should, what about my promotion to associate professor? What about my promotions to professor? You want to be a professor or a neurosurgeon, mister? What do you want to become? You want to be a professor? Go choose economics. Become a professor. Write all your papers. Become a professor in economics. Or some funny things. But if you are a neurosurgeon, stop writing papers. Stop worrying about p-values. These things are mundane. They don't have any value. If you cannot operate, they are nonsense. Imagine a neurosurgeon who says, I've got 100 papers in the most significant journals, but I cannot operate. Would you go to a neurosurgeon like that? So understand, writing is not important, operating is. Okay? Well, these are the things I have for you right now. You follow this, you will reach your goals. You can select from what I said. Nothing. Writing is your choice. You want to be a writer neurosurgeon? Great. You be a professor very young. You be academically distinguished. You would not have the tension for those big surgeries and heartbreaks for those really terrible, terrible surgeries. You would not have the heartbreak because somebody else will be doing it. All right. It's your choice. But if you want to be, Yuha says cowboys. So if you want to be a cowboy, no, papers are not for you. You want to be a cowboy, heartbreaks are for you. You want to be a cowboy, narrow and deep is for you, not wide and shallow. Corporates are not for you. Teaching hospitals are for you. Cadaver courses for you. Failures for you. A lot of surgeries for you. Okay. This is the price of being a legend. And always remember, last but not the least lesson is learn to be lucky. Work to be lucky. Okay? Nice, kind, forgiving. You may think this is not important, but believe me, it's really important. So I hope I made things clear. And, my presentation, for the first time, I put in a lot of time and did up a beautiful presentation. I even put the Bugatti Diva picture on it. Okay, but it never turned up. So maybe with the presentation, I was not so lucky. But again, I did my best. So let's see what you guys got to say.
Very good. Okay, thank you very much. Can you just mention before the panel starts asking questions? Can you talk about mentorship and personally? Who were your mentors and what did they mean to you as a budding neurosurgeon?
Yeah, I was very lucky, John. A mentorship is an extremely important thing because a lot of things in neurosurgery are things which you cannot figure out on yourself unless you discuss with somebody who's had the same failures. So I was extremely lucky to have Sano as my mentor. So after I finished my neurosurgery, I was in Japan 5 times in total, 2 years in total. So I was very lucky because Sano took me under his care, and he was like a father, a mentor, a teacher, a great friend, everything put together for me. I can never forget how kind and how nice he was, sitting with me, explaining things which I would never understand in vascular surgery, caring for me when I was in Japan. And I believe I am doing the same with my fellows around here. I always want to reciprocate whatever I got from Sano. I try and give it to my fellows. I try to make things understood for them, and I try to take care of them. So yes, mentorship is extremely important. Without a mentor, it's really difficult. By the time you figure out things, you are already in your 50s. So, and because you didn't have a mentor, you tend to be thinking that I learned it the hard way, let other guys learn it the hard way too. So that changes you as a person too. So when you have a mentor who's given you everything, you would tend to give everything to your students too. So in many ways, the mentorship is extremely important.
Mhm. Very good. How soon in your career do you recommend actively looking for a mentor? Would you say at the start of residency, or you wait a few years, or what would you recommend? Because we have a neurosurgeon now is starting his residency tomorrow. Ibrahim is starting with in Russia in Tayuman. So
I see. Well, I'm in Tumen next month.
Yeah.
Right. Well, during your residency, your mentor should be your head of the department. How bad, how mean, how bad, or how terrible he is, he should be your mentor. So this guy is pretty lucky because Sufiano is a fantastic guy. So, I mean, he would be anybody's dream head of the department. He's such a nice, chilled out guy. So anybody who's starting a residency, your mentor should be the head of the department. They are your teachers, you know. There are many times after you finish your course, you feel that your teacher was not up to the mark, or, you know, he was being mean or he was being terrible, but they are your teachers. They made your first strokes with the knife. So they made it possible for you. And if you forget that, maybe that's not a good omen for you. So after your residency, find out what subspecialty you're interested in. I was interested in skull base and vascular. So that's why I went to Japan. Immediately after my residency, as soon as I started work as a consultant, I went out seeking my mentor. I didn't know Sano was to be my mentor, but I went out to Fujita and I worked with him and things worked out. So I would recommend that somebody looks for their mentor as soon as they finish their course and start working independently so that you know what you're looking at.
Okay, very good. Marco, you have any comments for Iype?
Yeah, first of all, I want to thank Iype for your presentation. Very brilliant. You highlighted the main point of our job. That is a stressful job, very hard, but is fascinating. And I think that everybody of us decided to run in the neurosurgical field, not for money, because there are a lot of jobs less stressful than neurosurgeon, but very remunerative. And be a neurosurgeon means that you love your job. You are fascinated by the idea to make surgery in the nervous system and improve and sometimes save life of people. And I take advantage from this panel to highlight also, as I just told you, that the mistake in our profession is a fact. You don't be scared by the mistake, but learn from your mistake and improve. That's all. And thank you very much for your panel.
Absolutely.
I cannot hear you, John.
John,
I'm sorry. I'm muted. Yeah. Thanks. Thanks, Iype. Any other comments or questions? Ibrahim, you have any questions or comments? Since you're starting your residency tomorrow in Tayuman, a very big day for you.
I have not questions, but I wanna thanks for Dr. Cherian. Thanks you.
Very good. You'll be seeing him in Tayuman, Iype.
Yes. I'll be there next month. Next month,
okay. That's your yearly conference, right? You go up there every year, correct?
Okay.
Yes. We go every year. I can see Ahmed. Yeah.
Ahmed, do you have any questions or comments? Thank you for coming, Ahmed. Thank you.
You're welcome. How are you, tribe? How are you, Eugenio?
Hi.
You're good.
Hi, fine. Missing you.
We miss you also. I already miss you all.
Good.
Great presentation, Dr. Iype.
Thank you.
Yeah, Ahmed did a few months with Iype in Biratnagar. Now he's back in Yemen.
Yes.
Yeah, and hopefully we'll build a little community there in Yemen of having presentations by Iype and other doctors. Maybe Dr. Kabulo, if he wants to give a presentation. We hope to establish a learning center in Yemen.
Yes, we can start that. It will be slowly, but we'll do it eventually.
Yes, we will do it. Ishmael, the head of the department, is very open to
And
it.
he's very interested also, yes.
Yeah, he's very open to it because in places like Yemen, they're limited at having conferences because I guess the country's kind of in turmoil. But hopefully we can bring people like Iype in from other parts of the world to help teach the residents and to update them on neurosurgical practice.
Yes, we can do it.
Yeah, we can do that. Okay, let's see, anybody else on the panel have comments or questions? Hello, Prashant, how are you doing?
I'm fine, John.
Yeah, thank you for coming. I guess you got a little delay. You got a little delayed. I was talking about priorities and residency and what to do and what not to do. Let's see here. Who else we got here? Jitin, do you have any comments or questions for Iype? If Iype is still here, I don't know. Is Iype still here?
Yes, I'm around.
Oh, there you are. Okay. Okay, Jitin, do you have any questions or comments for Iype?
Yes, sir. Thank you, sir. Dr. Iype, very nice presentation, almost summarizing everything I wanted to inquire about. One last thing, my subspecialty is interest in functional neurosurgery. So, do you advise or how to establish a surgical research in any subspecialty, particularly in functional? How do a young neurosurgeon should project himself to start anything like that?
Well, I'm sorry, I would not know the answer to this because I myself, I do not know any functional neurosurgery at all. So if you could ask me on the context of skull base, then I can answer it. For example, when I started doing drawings, I wanted to figure out how I can improve it. So then I came to this orbitomeningeal band, which was something which was very, very difficult for me, which I could not understand how I could do bloodless dissection of the cavernous sinus. I wanted to figure out. It took me 6-7 years to figure out. I asked many people. I asked them, where do I start dissecting? Should I dissect from V2? So what I did is, I started this TCM concept, this dissection concept, and I wrote a paper. Okay, this was something, obviously it was not something new, but I put it all together and I wrote a paper and I started teaching it. Then, second thing, posterior clinoidectomy. It was something which was rejected by the whole neurosurgical community because it was such a dangerous thing to do. But with Sonopet or CUSA, or even the drill, if you're careful, drilling the posterior clinoid process gives you so much access in posterior circulations aneurysms like basilar tip, superior cerebellar, or even petroclival meningioma. So we devised a way of doing it. We devised techniques of how to do it, taught our residents how to do it in cadaver labs. When in surgery, we made videos of how we're doing it. So posterior clinoidectomy, we wrote a paper on it. Okay, again original. Anterior orbitomeningeal band, again original. We started working on skull-based approaches for cystonostomy, which is original again. Nobody had mentioned, nobody had talked about it before. So we thought about a series of things which were original ideas, and then started working on it. It was not easy To do a post-reclinodectomy is the most difficult thing in skull surgery. Then we combined Dolens with Kawase and saw what was the window. Started teaching it, started publishing on it. Now we are writing a textbook chapter on it. So what you need to do in functional, I don't know about what are the things in functional, but you need to look at original ideas, which are improvements of what is there right now. You should see how you can improve. Maybe by a radical idea like cystonostomy, which was completely different from decompressive, or something which is an extension of what people do right now. So this is what, as a young neurosurgeon, you should look for, and then work on it. So if you're talking about research, go original. Don't go for some few data here and there and make few papers. No, that's not what we want. Okay, we are neurosurgeons. Go for original things. All right. I hope I answered your question.
One more, sir. How much time do you say one should devote to lab and to the operative room?
Equal time. Okay, if not more. See, when you go and join a center, you may not have a lot of patients in the beginning. This is your best time. You know, I was very busy for 10 years. Then I joined Biratnagar. We are not busy at all because hardly 40 cases a month. And a team, a huge team. So I have to do maybe like a giant pituitary or a cranio or some aneurysm which my boys are not able to tackle. So very little cases for me. But this is the best time for me to learn. If you see, I mean, I will always have books, okay? Not necessarily books that deal with neurosurgery. Everything, okay? This is my best time to learn, all right? So books, cadaver labs, and surgical skill can even be learned by just sitting on your table, making small circles, making 1,000 dots in the circle. Count 1,000 patients, skill. So you don't really have to do a parafalcine meningioma to build up your skill. Your hand skill, try to do something impossible with your left hand. And these are things which can build up your skill. So lab should be as important or more important than surgery time. Believe me, you will realize it.
Very good. Vlad, can you hear me okay? Vladimirovich Kom? Can you hear me, Vlad? I want to see if you have any comments or questions. I believe you came last week. Let me unmute you here. Can you hear me, Vlad? Maybe not. That's okay. Maybe we'll go to Warlix. Warlix, are you there? Well, she may have stepped. Warlix, do you have any questions, Warlix? For I hate to see you sitting there quiet. Do you have any questions or comments for Iype?
First of all, I would like to thank. This is amazing and very important topic for me because I am counting down for my graduations to become a young neurosurgeon for real. After I graduated, I will move to back to my hometown to work in the small hospital, but specifically for all neurological case. And but in the institutions that I train right now, we have a lot of cadaveric conference. And you made me want to go to do the cadaveric tomorrow. We have our own labs to do that anytime, but but we have to set all the brains and we have to unfreeze by ourselves. So I was cheap, maybe, but as you tries to say what is important, so so you make me want to try on that more. And And so I thank you for you to make it. And I want to further my study as a neurovascular. I interested in that. Maybe if we really have a chance, maybe I would like to get a suggestion for you. I interested to go to be the fellowship in Japan. You know, I hope that I will get that. Yes. Right now I have already tell my teachers that I interested in that. So he often give me an opportunities to do and operate on the aneurysm case. Even it's just open the dura and waiting for him to creep. It's a great opportunities for me already. But I would take your advice that because once that he creeps the aneurysms, he will walk out from the room. Maybe next time I will try to cross the dura under microscope.
Yes.
Yes, I will not like take the microscope out, and but normally I will like, oh my God, I want to make it like finish the case. So I take it out, take the microscope out and do it under my eye. So, okay, I will start afraid right now because you say the transition between residence and being a real neurosurgeon is a big thing. So maybe tomorrow. Yes, and other things is I really like what you say is the failure. It's not as bad as it is, but I have an opportunity to operate on the case since I was third year, and I am always believes that if my case have a complications, I will always be the one who want to fix that by myself. I will not let other residents or other of my friends or maybe junior residents to fix that. Yes, and I used to be cry when my teachers comment me too, but it's make me strong. And yes, it's true. Even yesterday I operated on one case, but it's still not getting the good result. So I still think about that, and I have to present it to my teachers tomorrow. Thank you for that. That's amazing.
You must always remember, Boralex, that unfortunately our young generation, the younger generation has been misled by a group of neurosurgeons who are so insecure enough so as to present only the successes in the most exaggerated fashion. You know, if you have to do a Dolenz and a Kawase successfully, you know how many failures you must go through?
Oh, I never.
If you must beautifully clip an aneurysm, you know how many failures you must go through? All this is important because today if I show only the beautiful video and you think, oh, I am not able to operate like this, is completely wrong. Is because I have failed so many times with respect to and been strong enough to overcome and step out to the theater next day for the same kind of case and do something more better. This is the only way I can advance or I can make these videos. And again, I fail again in between. Sometime I fail again. Even after this, I fail again. So if our big neurosurgeons, they don't acknowledge this because they are afraid that they will be said, oh, this guy is an idiot. He doesn't know how to operate. Everybody is afraid. So they don't want to say or show that they have failures. And, you know, this has become the trend of conferences. It's like circus, where you take all your best videos and edit out the bad parts, show the good parts to young neurosurgeons, and these guys believe that there is nothing more than, there is nothing, and if I make a mistake, it is a complete failure. This is not the truth. If you go to a good theater, where, I mean, I have seen Sano operating. He's one of the best surgeons I have seen. I have seen Hasegawa operating. These both are legends in skull base and vascular. I have spent 2 years with them. I know what it is like. And the people who spend with me, they know it's not easy. You can show fantastic pictures and fantastic videos, but it's not easy. Okay? So learn that as a young neurosurgeon, always remember that, and be more and more strong from your failures. You are at least lucky you are not in the Indian team for cricket, I say, because 2 failures and they take you off the team. Okay, if you are in football, 2 or 3 failures, they take you off the team. But in neurosurgery, you are in the team, you are the team. Okay, the more number of failures you make, the more better you become. Okay, the more better you become. So you always learn and be better, and don't be ashamed of your failures. Okay, learn from this.
Thank you, sir.
Thanks, Iype. Tanmay, do you have any questions or comments? Or go ahead, Marco. I'm sorry.
Yeah, just had one thing, even for Voralux. In the North European meeting of neurosurgery, and in Italy we're starting, even if we are a little bit shy. In the meeting, there is a session of mistake in neurosurgery when everybody show a case where a mistake happened. For example, I performed a stabilization, but the patient was not suitable for stabilization, and the case got to fail. But I'm telling this because me and you can learn from our mistake. That's all. So don't be afraid of a mistake, but learn and do it better and better every day.
Thank you.
Yes, but one time that I remember, and I do an operate on the brain tumor case, and I think that my case had complications, and then eventually I call my teachers to come and assist me in the case. And then he saw me, but it's too late to help because the brain is all swollen. He just like come in and he come and he told me to like just do the suture. And then he's like, he did not blame me at all. But it makes me feel like so that on the next day I walk and talk to him. But I thought he was gonna blame me, but it's not. He tell me that he asked me how I performed the case. So he tries to find that what any procedure that I might be missed, and then he set that case and operates with me again. So mentor is very important, that you say, Dr. Iype. And for the case presentations for the mistake, I used to be shy when I was young residents and this, but when I grown up and I feel myself that one day I have to become real neurosurgeons, I think that I have less time to learn from my mistake under control from my teachers. I will offer my God help now. So yes, I need to learn. Thank you, Dr. Marcos.
Thank you too, Brad.
Very good. Tanmay, do you have anything you want to say? You're quiet over there.
Yeah, it's a wonderful presentation and so many new things we got to learn how to become calm, and many tips are given by Iype sir. I thank a lot to him.
Okay, thank you, Tanmay. Okay, very good, Iype. Thank you for taking the time, and thank everyone for coming. And any closing comments or questions, Iype? Anything to say?
Well, nothing, John. Thanks for Ahmed has something to say, it seems.
Okay, go ahead. I'm sorry.
I just want to add some comments.
Yeah, sure.
Sometimes complications are the best way to learn, especially if you take responsibility of the case and to try to fix the complication. And sometimes you must ask for help. This way you can learn from your complication. You can not repeat it for other cases. So this is very important. And in the early of residency, something that I learned from my mentors and my teachers, like Dr. Iype and Dr. Ismail, that you can't learn from anyone, not only from seniors. Sometimes you can learn also from nurse, how to do suture by a certain way, how to close. So you will never feel that you are above everyone. You should learn and take advantage and small steps. By this way, you can improve day after.
Okay. Okay. Very good. Sue, you came back. Do you have any comments or questions for Iype before we close?
Yeah, thank you very much, Dr. I have no question.
Okay. Very good. Thank you for coming, Sue. And once again, thanks everyone for coming, and thank especially to Iype. So hopefully we'll see everyone next week. And hopefully Werelux will bring academic teaching to the rural areas, hopefully at Neurosurgical TV with Iype and me and others. Okay, Iype?
See you, John.
Okay, thank you very much. Thank you very much.
Thank you.
See you guys.
Thank you.
Thank you for coming.
See you guys.
Okay.